My name is Augusto Mirabale. I am an associate professor of neurology at the University of Colorado Anschutz Medical Center. I provide care at Advanced Neurology of Colorado in Fort Collins, Colorado. As a foreign medical graduate, I experienced firsthand how culture can influence people's perception of health, as well as the delivery of healthcare among individuals from different cultural backgrounds. For example, after learning the importance of shared decision making with patients during my residency and fellowship in the US, I was surprised to experience that many of my Hispanic and Latinx patients prefer to have their healthcare provider assume a more paternalistic role. Even though the incidence of all-cause dementia in Europe and North America has declined by 13% per decade over the past 25 years, the incidence of Alzheimer's disease and related dementia among Hispanics and Latinx populations in the US continues to increase. By 2060, Hispanic elderly with Alzheimer's disease and related dementias are projected to reach numbers close to 3.2 million. Older Hispanics are about 1.5 times more likely to have Alzheimer's disease or other dementias as older whites. When it comes to disparities in Alzheimer's disease care, there are many factors to account for within underrepresented and underserved populations, including Hispanic and Latinx people. Access to healthcare and healthcare coverage are perhaps the most common barriers. This can be further exacerbated by an individual's legal status, particularly for those who are undocumented. Language is another common barrier. In my opinion, language and communication problems may also lead to patient dissatisfaction, poor comprehension and adherence, and lower quality of care. Spanish-speaking Latinx people are less satisfied with the care they receive and more likely to report overall problems with healthcare than are English speakers. They are also less likely to visit a physician or mental health provider or receive preventive care than their white counterparts. This can be further exacerbated by stigma. I often see patients who have their culturally acquired belief that cognitive symptoms associated with Alzheimer's disease are embarrassing. Given the experience of discrimination and stigma that many underrepresented and underserved populations, including Hispanic and Latinx patients, face, it is not surprising that they desire care from healthcare workers who are culturally competent. 85% of Hispanic people say it is important that their Alzheimer's disease care providers understand their ethnic or racial background, while only 59% of Hispanics feel confident that they have access to such culturally competent providers. So let's define what cultural competence in healthcare is. Cultural competence is the ability of providers and organizations to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. A culturally competent healthcare system can help improve health outcomes and quality of care, especially in racially and ethnic populations. 1 in 5 Hispanic Americans say that they would feel insulted if a doctor suggested an assessment for their thinking or memory. In my experience, this may not be due to the fact that these individuals do not understand the importance of cognitive screening. It has to do with the fact that our approach may not resonate with their cultural beliefs. Recently, a patient came into my practice with his wife and 2 daughters. All of them were fluent in English, so my medical student took their medical history in English. However, when I entered the room and started speaking in Spanish, the patient started to use humor with me. The patient's wife explained that he does this to mask his depression as a compensatory mechanism. This is a great example of how our approach needs to be culturally competent. Speaking in Spanish allowed me to uncover mental health struggles such as depression and anxiety that may be contributing to the patient's cognitive impairment. As you can see, it is imperative to develop training and educational resources for healthcare providers to acquire the basic skills and competence to provide culturally appropriate care across cultures. This is particularly important for disorders like Alzheimer's disease, one that can disproportionately affect underrepresented and underserved communities. But providers must also be aware that cultural competence comes with the risk of stereotyping and categorizing of particular groups, which can contribute to increased stigmatization. For example, when seeing one of my older Hispanic Alzheimer's disease patients, I used a more paternalistic communication style. However, I realized that his daughter, who was a key decision maker, felt more comfortable with the shared decision-making approach. As you can see, cultural competence is an ongoing learning process that needs to embrace a stance of cultural humility. Cultural humility involves understanding the complexity of cultural identity, and that an individual will never be fully competent about the evolving and dynamic nature of a patient's experiences. It encourages us to learn from our patients and the communities that we work with to develop a better understanding of the people we serve. Some practical ways to improve cultural competence in your practice are: provide interpreter services, recruit and retain underrepresented and underserved staff, provide training to increase cultural awareness, practice cultural humility. As a provider, self-awareness and humility are key in meeting the needs of our culturally diverse patient population.